The treatment for the disease is still local. Even though this is herpetic stomatitis, we don't use the etiological drug acyclovir. Or rather, we do use it, but mainly topically, and sometimes orally. As local anesthetics, a gel with lidocaine is used, as well as a local anesthetic gel. For local antiseptics, chlorhexidine is used, for example, or miramystin. It is also possible to use 5% acyclovir ointment. It can be applied to the red border of the lips or to the tip of the tongue so that the child can make a few movements like this. The effect will already be present in the oral cavity, acting on the blisters themselves. In severe cases, acyclovir is indeed used in children over 2 years old. 200 milligrams, 5 times a day, for 5 to 7 days. If we have confirmed the etiology of this disease as herpetic stomatitis, in severe cases, when we see signs of a secondary bacterial infection, antibiotics are indeed used. I want to reassure parents because, of course, everyone thinks that all moms and grandmas can treat stomatitis at home. I would like to warn you, in any case, consult a specialist. Here, local treatment is possible. The disease may resolve on its own, or the child may need more in-depth treatment and examination. In treatment, local antibacterial agents or antiseptic solutions for rinsing the mouth can indeed be used. I won't mention any brands. This isn't an advertisement, but these are widely used. Although these are anti-inflammatory drugs, not antibacterial ones, it's also possible to use other local medications. Most often, local therapy is used here, as well as treatment of the underlying disease, which could have caused this manifestation in the mouth, because there is chronic aphthous stomatitis. These small, round-shaped lesions are surrounded by a slight rim of redness, and later on, they can develop a grayish-yellow coating. This is quite typical. It is clear that this is aphthous stomatitis, and it's always important to understand what it is occurring against the background of, especially if it's chronic aphthous stomatitis. In some cases, when we might suspect the manifestation of secondary bacterial infection here, considering that aphthous stomatitis itself does not usually present with severe intoxication symptoms or high fever, there may be only a mild fever or almost none at all. But if you see that after a few days fever appears, there is pain when swallowing, and the child refuses to eat, the aphthous take on a different, unattractive appearance, and the child's behavior changes accordingly. Even with a high fever, the child becomes quite lethargic, shows resistance to being examined by the doctor, and is negative even towards the parents. You can see a clear worsening of the symptoms. In such situations, of course, antibacterial therapy is used, but it is still preferable to consult a doctor. Antibacterial therapy is, naturally, systemic, along with the use of various oral antiseptics. Whether it's methylene blue for treatment, or tantum verde for rinsing the mouth, or other antiseptic and anti-inflammatory drugs used locally. Here, it's always important to clearly understand the line between what should be treated locally and when it's necessary to start systemic treatment with these antibacterial drugs. Very often, simply eliminating something is enough. If you notice that right after eating or taking a certain medication or something else, there is a clear connection with this allergic reaction. The onset of the stomatitis, for example, is strictly limited to the time of intake and is clearly manifested on the mucous membrane. In such cases, you really need to keep the child away from that medication or food product And very often this happens with things like fish or shrimp, for example. All of this is possible, and we see it all the time. What is used in such cases? Most often, common antihistamines are used. We try to treat the oral cavity. This is very important to understand. In the oral cavity, we do not use antiseptics here. This is very important. They themselves can cause an allergic reaction. So here, elimination and protection from the agent are key. 5 to 7 days is enough for this allergic stomatitis to resolve if there are no other symptoms. Just this manifestation and the use of antihistamines are enough. It will go away on its own. Topical medications are used, as well as antifungal drugs, both locally and orally. Topical treatments are used, such as a percent solution of methylene blue. There is also a clotrimazole cream, though it's not always very precise, but it's also good for use on the child's oral mucosa, for example, treating in the morning and evening. But in cases of widespread candidiasis, where the doctor tells you that this is not the case here after all, if the disease is not limited to just the oral cavity and the doctor sees a condition here that is possible, for example, in children older than 5 years, then medications like fluconazole and itraconazole are prescribed orally, as well as antifungal drugs for further treatment. Although sometimes the treatment can be prescribed for up to 4 weeks. Confirmation of candidiasis is needed. Laboratory confirmation of a widespread candidiasis process. Don't forget that stomatitis can be a manifestation of widespread candidiasis. In such cases, treatment is prolonged under a doctor's supervision with monitoring, cultures, blood tests, and extended medication for up to 4 weeks or even longer.